Hey, welcome back. Today's lesson is temper tantrums. A temper tantrum is when a child has an unplanned outburst of anger and frustration, which can be physically, verbally, or both. Your child may act out, be disruptive, and generally display unpleasant behaviors. Usually, they are acting like this because they want or need something they can't express with words. Tantrums are often disproportionate to the circumstances. In other words, children react very strongly to what is likely a mild situation. Tantrums are a normal part of your child's development. They happen as a child learns to become more independent, and the tantrums happen most frequently between ages 1 and 4, averaging up to 1 a day. They typically decrease when a child starts school, and at this age, they are talking more so they can express their needs verbally when they start school. Tantrums usually last between 2 and 15 minutes. When we see the cause of temper tantrums, they can include frustration, wanting attention, wanting something, avoiding doing something, hunger, and tiredness. A big cause of toddler temper tantrum is the conflict they feel. They seek independence but still crave their parents' attention, and they haven't developed coping skills to deal with strong emotions or disappointments. They often lack the verbal skills to explain how they feel, so they lash out instead. A child's temper tantrum is not a reflection of poor parenting. Tantrums happen because of a child's personality and the current situation. They are a normal part of child development, so it does not mean you are a bad parent or there is poor parenting. Try the strategies during your child's temper tantrum. The first is find a distraction. If you sense a tantrum starting, but it hasn't become a full-blown outburst, try to distract your child. Point out something interesting or engage them in an activity. The other is stay calm. Once your child is mid-tantrum, don't threaten, lecture, or argue with them. Doing so only makes them the tantrum worse later. When your child is quiet and calm, talk to them about their earlier behavior. So don't interfere when they are mid-tantrum. The other is ignore the tantrum. This shows your child that the tantrum is unacceptable and won't get them what they want. The other is keep them in sight. If you are in the middle of store or other public place, make sure you can see your child at all times. If you feel your child may hurt themselves or other people, remove them from the environment. Then keep them safe. Remove any dangerous objects near them. Consider holding your child so they don't hurt themselves. If your child is completely out of control, bring them to a safe space until they calm down. Use a timeout if necessary, placing them in a room away from TV or and other distractions. Also, try not to give in or change your mind. If you do that, children learn that tantrums help them get what they want. If you are at home and your child is safe, you can even try leaving them and going into another room. And also, try not to hit, bite, or kick them. You may think this teaches them that these actions hurt, but the opposite often happens. Your child may learn that this is acceptable behavior because a parent is doing it. Instead, make it clear that they are doing something hurtful which is not allowed. Once the tantrum is over, you can engage your children in conversation about what happened. You can also discuss how they can stop tantrums from happening again. Try to offer praise for calming down after the temper tantrum. Acknowledge their feelings. Teach your child to label emotions. Teach your child how to handle strong emotions and set a goal example. You can take steps to reduce the frequency and the severity of tantrums, just to prevent a temper tantrum from happening. The first one is give a choices. Let them choose within reason. For example, they can choose between two outfits or two snacks. Being able to choose helps your child feel in control. Make sure to let them choose between two things you are okay with. The other is prepare for transitions. Periods of transition, such as leaving the house or the playground, can be difficult for children. Try to prepare them in advance that a transition is coming so they are ready for it. Check food and sleep, because sometimes irritability can lead to tantrums. This behavior may come from lack of proper nutrition and sleep. Make sure your child eats and a balanced diet and gets enough sleep. Contact your child's health care provider about temper tantrums if they persist or get worse after age 4 years. Your child hurts themselves or someone else or damages property during tantrum. Your child holds their breath during a tantrum, especially if they are infant or if they develop a faint. Your child has headaches, stomach aches, and anxiety. You feel frustrated and unsure of how to handle the tantrum safely. Thank you for watching.